Episiotomy is outdated and is not needed. What, why? I asked a friend recently when I told her this. I knew that if you're birthing vaginally, you will have it. I mean, it's part of the birthing process, the normal birthing process, right? I got a big one, and it still pains. I never knew it can be avoided. Is that true, Divya?
This is the Birth Agni podcast, the fire that brings us alive, that burns myths and opens a channel of authentic natural birth stories. This show debunks the many myths of the medicalized births, showcases the plethora of choices a pregnant couple can make to embark on their empowered birth journey. I'm Divya Kapoor, a certified birth and lactation counselor and an aspiring traditional birth attendant. Let's get the flames blazing high.
Often women either fear a surgery or they are fine with the surgery because they want to avoid an even bigger fear, episiotomy, on their intimate area at all costs. And a cesarean seems better than an episiotomy. What is an episiotomy? Episiotomy is a small surgical cut given to women near yoni right before the baby comes out, in theory, to avoid tearing during birth. In India, local dais or traditional midwives call it chota operation, meaning minor surgery, and cesarean is called bada operation, aka big surgery. I would tell you, even before we move further and explore, when was episiotomy introduced as a practice? How old is this practice? What was the reason for it? Has it improved outcomes? How were women birthing before this small surgical procedure was introduced? I would tell you, even before we explore all these points, that episiotomy is outdated and is not needed. What, why? I asked a friend recently when I told her this. I knew that if you're birthing vaginally, you will have it. I mean, it's part of the birthing process, the normal birthing process, right? I got a big one, and it still pains. I never knew it can be avoided. Is that true, Divya? Well, I will answer this at the end of this episode, so stay with me. When was episiotomy introduced? While we do not know exactly when, but the mention of it was first recorded in a book written by an obstetrician, Sir Fielding Auld. Irony is in the name, Fielding. His book called Treatise on Midwifery in 1742, wherein he wrote how birth should be managed. Quoting him, "It sometimes happens through the labor has succeeded so well that the head of the child has made its way through the bones of the pelvis, that it cannot, however, come forward, by reason of the extraordinary constriction of the external orifice of the vagina, so that the head, after it has passed the bones, thrusts the flesh and integuments before it," meaning the baby is stuck, "as if it were contained in a purse, in which condition, if it continues long, labor will become dangerous, by the orifice of the womb contracting about the child's neck. Wherefore, it must be dilated, if possible, by the fingers," meaning the cervix should be dilated by the fingers, "and forced over the child's head. If this cannot be accomplished, there must be an incision made towards the anus with a pair of crooked probe scissors, introducing one blade between the head and vagina as far as shall be thought necessary for the present purpose, and the benefit is done at one pinch, by which the whole body will easily come forth." So this guy mentioned it in his book, meaning he must have done it in his times when the baby was stuck. After that, there was another OBGYN, Deely, who is also the inventor of the baby's airway suction catheter and a head fetoscope, like a stethoscope which is used to hear the fetal heart rate but is worn on the head. He was the inventor of both of these devices and a lot of other medical advancements. Why would he do that though, that he'd have a stethoscope or a fetoscope on the head? I'm thinking. So maybe you have your hands free, probably that is why. So anyway, so Dealey, although a good doctor who helped a lot of low-income moms birth at home, he was wary of midwifery. He saw a lot of maternal mortality in low-income families, and he rejected midwifery and preferred building a fresh expert base by teaching students at births, which he attended. Well, he could have really trained midwives further, in my opinion, without disregarding traditional wisdom and rather using it and supplementing it with the new medical advancements. But he was not in favor of traditional wisdom or traditional midwifery. He did not believe in it. He did so in science. Once he became quite a public figure, he gave a speech at American College of Obstetrics, ACOG, in 1920 and said, "We must improve obstetrics and use routinely and preventively procedures such as episiotomy, active management of placenta," meaning not waiting for the placenta to be born, but going inside the woman's yoni and scraping it out. Also, using forceps for the birthing of the baby, doing all these procedures preventively. Because, in his own words, he looked at birth as dangerous. That childbirth was a suffering and birth a pathological process. He, in his times, single-handedly influenced a great deal of medicalization of the birth as we see it today, detrimental to the process. But even at that time, some of his counterparts disagreed and warned, and Dealey acknowledged. "Doctors who have no business of doing operations will do it. This is unfortunate and unavoidable," he said. Meaning, who could birth just fine may be preventively put under the knife and undergo a major surgery as a result of his stressing on preventive intervention. But what was the reason for it? Other than the above perceptions of the people from the times who kind of emphasized on episiotomy and the expert being superior, the syndrome of that, the complete disregard of midwifery at the heart of it all, of the propagation and advancement of medical technology, even if it was at the expense of the best interest of mum and the baby, there were some other medical reasons as well that were cited. A stuck baby, like we just saw. A neat cut on the perineum, on the woman's intimate area, so that can be sutured without any inconvenience. A natural tear will be hard to stitch. A neat cut is easier to stitch. Has it increased outcomes or improved outcomes, Dealey himself recognized back then that pregnant women who entered the expanding number of hospitals did not necessarily fare better than their sisters who birthed at home. So no, it did not improve outcomes. How were women birthing before episiotomy was introduced? Women were birthing in positions of their choice, usually squatting. Midwives facilitated this, and the tears hence were less to none, sometimes just lacerations. For a stuck baby, it can be moved and brought out using hands. Lying on the back to birth is what was prevalent in hospitals, and that reduces the space to birth. So the problem in the first place was forcing women to lie on their backs to birth. The solution potentially became to cut their intimate area to get the baby out because the space was less. This, on the whole, was not beneficial. And now the big question that my friend asked. Can women birth without an episiotomy? Yes, they always have. How and why? Now back to anatomy and some basic science and how the body works. Your anus and your yoni. Anus is from where you poop and yoni is from where you birth. Also your cervix. Cervix, the pleasure powerhouse of the body. Cervix is also the place from where women bleed out month on month. So your cervix opens when you're bleeding in your bleeding time, and it closes for the rest of the time. These are your anus, your yoni, and your cervix. These are the muscles that can expand, open, and shut. These are what are called sphincter muscles. When you sit on the commode unwatched and private, you poop well. You're fine. You just poop. Many people find it hard to poop when they're in a new place. The reason behind it, that they don't feel safe in that place, so they let go and they allow these muscles to open up. Your yoni, your anus and cervix. It needs privacy to relax, because cervix is also a sexual part of the body's, like the sexual function is one of the functions it has. So it needs privacy to relax and open up. And they do so best when you are in an environment that you trust and feel safe without an expert watching you perform your birth well. Did you do that well or not? So this creates a feeling of being watched. Well, in hospitals, women are made to lie on their backs to birth, which further to the lack of privacy is the second deterrent to the birth process. So the doctor can see that your baby is not coming out and will not want to bend and have you birth in a position that you like, which is why many women end up birthing against gravity. Plus your bum gets squeezed to 30% less space. And hence, of course, they thought they need to cut women to make space for the baby to come out vaginally. If they adopted midwifery model and let women birth in a position they like, more upright and in favor of gravity, there will be less tears, less stuck babies, and no need of a cut. Today, the research has finally, after all these years, embraced some common sense. And if you've followed me on my newsletter, meaning if you're subscribed to the newsletter, the last birth wrap that went out was about the history of childbirth, wherein I spoke about how many basic processes that have been detrimental for many years, they take some 20 years before they are ruled out of practice. Meaning, it may be common sense for you to rule out an episiotomy because very quickly you realize it's not helping, but it will take 20 years of written work, of researchers, of people proving it before another practice comes and starts getting used world across. So today, however, routine episiotomy is no longer indicated due to the adverse effects associated with the procedure. In a research paper, it says the adverse effects, meaning perineal pain, dyspareunia, and sexual dysfunction. Episiotomy was considered necessary previously in certain cases where rapid delivery in the second stage was needed. Example, fetal distress, shoulder dystocia, or operative vaginal delivery. However, evidence demonstrates today a clear benefit in these settings is limited and inconclusive. So this was from a part of a research paper that says it's not needed. Anne Fry, a renowned midwife whose literature is read by women wanting to be midwives, calls this procedure clitorotomy because episiotomy cuts the nerves to cervix as well as clitoris, the pleasure powerhouse for women. So she compares it to genital mutilation in the name of birth. That's all I had to say about episiotomy in the podcast today. In my private childbirth classes, one-to-one couple sessions, I elaborate further more on a lot of damaging maternity practices that you should say no to. I also support you in how to initiate and navigate these discussions with your care provider. If you have any questions for today's episode, please write to me. Visit www.birthagony.com. You can also book a free discovery call with me there to sit and chat with me. See you next.
There is a field beyond fear, where the body is empowered to take on labor and birth. To land there, it is crucial to take birth education. To enroll into our unique labor and birth preparation course, reach out to us at www.birthagony.com or scroll through all available prenatal and postnatal preparation classes. Thank you for listening, all in the spirit of birth, womanhood, and freedom. Remember, you got the bar. This podcast is about physiological birth and does not offer or claim to provide medical knowledge or diagnosis.
Starting a podcast with poor recording tools in the market? It was painful until I found Zencastr. Its high quality audio and video recording, along with the option of a backup, makes it super sturdy and a savior at times. With an easy to use dashboard and super convenient tools for advertising campaigns such as reels and videos, Zencastr is my comfort choice. Go to zencastr.com/pricing and use my code BIRTHAGNI, BIRTHAGNI, and you will get 30% off of your first month of any Zencastr paid plan. I want you to have the same easy experiences I do for all my podcasting and content needs. You may also explore their free hobbyist plan to begin with.